Well, we're going to turn now to the fight against COVID-19 as Omicron surges around the country. Some states are already shifting policies on masks in schools, and the hot-button issue has parents divided. We hear from moms and dads now sounding off on their opinions on our series, Your Voice. Take a look.
We do not have any desire to cause a scene or to ruffle feathers. We certainly don't want to make life harder on our teachers or school administrators. We support them. We did feel entitled to request that our kids be allowed to remove their masks.
I feel that parents should have rights with their own children, medically and educationally, and this has definitely crossed the line.
I'll tell my kids to continue to wear them even if they are optional, just for their safety, everybody else's safety. My son just got over COVID. He's been fully vaccinated. I just think it's a smart thing to do to keep him wearing them.
I don't want my kids to wear a mask. As a matter of fact, I don't think they're helping at all. So yeah, I want them to breathe fresh air. I have a son who is in speech therapy. So if he's going to receive a treatment, how is he going to see a teacher talk to him? He needs to see a lip movement.
It's a total surprise. I wasn't expecting that at all. I figured with the numbers that we're seeing in the news, it would go on for more time.
This is just not acceptable, and it does not follow the science. I'm in LAUSD. For me, I could have moved to Ventura County, Los Virgenes County, to go into a different school district. But with this new statewide legislation, if my only option is homeschooling, it's either homeschooling or removing.
Schools and COVID are one of the hot-button issues in our politics as well as our lives. But let's just talk about the medicine of it. Let's, after hearing from parents, let's hear from the U.S. is now reporting an average, I should just say, of 716,000 new cases a day. That's down about 10% since last week, but it's still really, a lot of COVID swirling around the country. So, for more, let's bring in board-certified emergency physician, ABC News medical contributor, Dr. Darian Sutton. Dr. Sutton, good to see you. So let me ask you, beginning yesterday, students in Los Angeles public schools must wear a non-cloth mask with a nose wire at all times, including during sports. So as a physician in L.A., how do you respond to this? How do you look at this?
Well, first off, I have to respond to the parents' concerns. I understand that this is a surprisingly divisive issue. The goal of these requirements and these mandates basically to help keep schools open. We understand that school districts that follow mitigation rules like providing masks for students and having them wear them during the day, higher level of ventilation and some level of surveillance testing have decreased risk of outbreaks. And schools that have less outbreaks are more likely to stay open so that children can receive the education and social interaction that they need. I understand the concern of the fact that masks may inhibit learning, but I have to say that we don't have a choice in this moment. We have a surging pandemic. We have approximately 25.5% of cases, all new cases being children under the age of 18. And just and to understand that number, the children under the age of 18 only represent 22.2% of the U.S. population. So there are more children testing positive than there are percent-wise. And so when you look at these numbers, it really becomes clear, what do we need to do to prevent the risk of transmission? And the simple answer is wearing masks.
And that's what they've decided in L.A. As you say, it is surprising. It is controversial in many places. So let's turn to the news. Pfizer and BioNTech have begun studying a COVID-19 vaccine that's tweaked to match the Omicron variant in healthy adults. Dr. Fauci predicts a potential peak of mid-February for Omicron. So it just feels like, we're in real time with this pandemic moving through the human population. Are we going to get vaccines for every variant? Is this too late for Omicron? What's your read on how the drug companies are responding and how we should deal with the tools they're trying to give us?
So great question. I want to first start by saying that the vaccines that are currently in use, those that are available to all U.S. citizens and all U.S. Americans and people within the United States include Pfizer vaccine, Moderna, and Johnson & Johnson. They're proving incredibly effective at their main goal, which is keeping people out of the hospital and preventing death. And now what we're seeing is scientists using the present information that we have to try their best to predict future threats. And by that, the Pfizer and Moderna are both producing vaccines that are targeting these new variants, specifically the Omicron variant. They're studying the effect of an additional booster that is targeted toward the Omicron variant, and they're also studying a full vaccine series that is targeted toward the Omicron variant. This will take likely months to pan out, and I will say that the goal of this is not really to use this right now, as there's no immediate need, because we're finding that vaccines plus boosters are providing incredible protection. It's really, again, preparing for the possibility of a future threat in the setting of this ongoing variable pandemic.
It's amazing to watch it. It really is. So the FDA has pulled now emergency authorization. This is going the other direction for monoclonal antibody treatments by Regeneron and Eli Lilly, saying they're not effective against the Omicron variant. In response, earlier today, the governor of Florida, Ron DeSantis, continued his attack on the FDA's decision to pause the use of these monoclonal antibodies, calling it reckless and vowing to fight back. So let's take a listen to him.
This is wrong what they're doing, and we have many people now who are very concerned because they were going to go in and get it today or tomorrow, and now they're being told that it would be illegal for a provider to give it to them, all based off one observational, non-peer-reviewed study, and this is done, I think, in a very haphazard fashion.
But Dr. Sutton, Ron DeSantis getting a reputation as a dissenter on a lot of COVID policies. He's a smart guy. He's done his own research, as they say. What do you think of his response to this?
Well, I'm glad that he's reading some type of research, but I encourage him to read more. What we do as physicians and other providers is that we look at our interventions and assess the benefit. And what he has to understand is that these monoclonal antibodies were developed initially towards the original strain. And as time goes on and variants develop, we have to reassess our medical interventions. And we found that these monoclonal antibodies are not providing the additional benefit that we were hoping for and that we saw with the Delta variant and prior variants. And so what do? We go back to the drawing board and we use our other interventions that are proving to be more helpful. And that includes, but it's not limited to, antiviral medications, immune modulators, as well as oral medications. And then we have the best form of prevention, which are vaccines. All of these treatments are meant to supplement the addition of vaccines. So again, I encourage people who may not be treating patients themselves to take a little bit more time to read that data.
Right. Do your own research on and listen to the people who do the research as well. Dr. Darian Sutton, thanks very much for that. Appreciate it.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.